Hello, everyone, and welcome to our June 2nd, 2021 All In for Kansas Kids bi-weekly webinar. And we are, as usual, happy to have those of you joining us that have been here before and welcome all newcomers that might be here with us today. So as we go through the next hour, we will start our meeting, as we always do, with general updates with information that might be helpful to you in your work throughout the early childhood field in Kansas. And then we will move into our program for today, which is the Child Care Provider Experience Mapping Project. And we will have a couple of people here to report on that. Before I get started on the general updates, I want to make sure that all of you know that you are welcome to comment either by using the chat or by coming off mute anytime during our presentations today, so that we want to hear your comments and what you have to contribute to our conversations. So our first update is you are welcome to have public comment on the Child Care Development Fund state plan, and that is happening by a public hearing this afternoon. So at 2 o'clock today, for any of you that are interested in doing that, there's a link here provided for you to go to and register, and it also explains how to submit written comments. The Parent Leadership Conference, which I think we also have mentioned a couple of weeks ago, it's starting in July. Registration is now available, so you can go to this link here to sign up and see all of the conference details. But starting July 1, you can watch recorded sessions, you can visit exhibit booths, you can network with other parents, and then there's also opportunities at the end of the month in July, the 27th through the 9th, to see some keynote speakers presenting, and a parent cafe that is available. So this is a very exciting opportunity and has been well attended in the past. This year they are still hosting it virtually, but hopefully we will be able to have a lot of people attend. And there are some incentives provided for parents who attend all 3 live evening sessions. That sounds kind of exciting to me. I don't know what that is, but maybe you should find out. So go check that out. Child Care Aware has just made available their 2020 Child Care Supply Demand Report. And again, there is a link here for you to go look at that. But it really is illustrating difficulty in navigating decisions around closures during COVID, the impact that had on family child care, and then also critical conversations are taking place about early childhood and how critical it is to the economic development infrastructure throughout our state. So it's a very informative report. I went and looked at it this morning. It's long, it's 18 pages long, but it's very nicely put together. And I think it's valuable information that a lot of you will want to take a look at. The ASQ trainings are available happening in June. The first one is the ASQ3, which is on June 22nd. In the evening, registration link is available here. And for anyone who is not familiar, the Ages and Stages Questionnaire 3 is specific to children, to identify children with developmental delays, and how to identify those, how to discuss screening results, and referrals to community resources with families will be discussed. And it's for any professional who has contact with children younger than 66 months of age. And so if you're interested in that, that's on June 22nd. The ASQ SE2 is available on June 24th in the evening, and that is training for any professional who has contact with children younger than 72 months of age. And that training is to identify social or emotional difficulties. So please go to one of these links and learn more about those available trainings. There are also some free child abuse prevention trainings coming up offered by the Kansas Children's Service League. These two listed are the ones happening in June. And so again, you can go to this link to register and to find out information. They are KDHE child care licensing approved hours, and all participants will receive a certificate of attendance. There are also some that are available in July, which I'm sure you will find on that link. And then we will continue sharing out this information throughout the summer.
Hey, Debbie. So these are just a couple of the offerings that are available for June. I just couldn't fit all of them on the screen. So there was probably 6 or 7 that were sent out in an email by KCSL. So if you go to that link, you can see the full calendar of everything. But I just thought these were the 2 kind of ones that jumped out at me as far as keeping up with certifications and things like that. So there's definitely more for the month of June. These are just 2 that we highlighted.
Okay, thank you, Hannah. So now we are ready to move into our program. We have Megan Kluth with the KU Center for Public Partnerships and Research with us, as well as Isabel Swiderski, who is from Orange Sparkle Ball. And they are going to be sharing out information that they just collected in their child care provider experience mapping project. So welcome to Megan and Isabel. Thank you for joining us today, and we look forward to hearing what you have to say.
Thank you so much, Debbie. We are delighted to be here and to share some of the findings. I know many of you have heard about this or helped share the survey or heard probably little sneak peeks over the past few weeks. But we're really excited to kind of dive into some of this data and share what we've learned over the past few months, as well as an update of where things are with the project. So with that, I am going to hand it to Isabel from our partner Orange Sparkle Ball, who really helped lead this work.
Thanks, Megan. Thanks, Debbie. Thank you so much for having me today. I'm really excited to report back on this project that we've been working on with CPPR. So this started in January, and the impetus was really to engage with childcare providers to get a real sense of what their lived experience was like going through the licensing process. And so if we can move forward in the slide, and one more, please. And so we engaged in this work with the thought of seeing how far can we reach, how can we ensure that we are directly connected with childcare providers. And we really looked at the journey from the pre-licensing, motivations, what comes up, what are some of the circumstances that get people interested in becoming a licensed childcare provider, and then what happens when you engage in the process, when you become licensed, and what happens after you're licensed. And so we broke up the project in multiple facets, and it started out with desktop research of the context. So we essentially, our team pretended that we were a childcare provider, that we're motivated to get licensed, and tried to gather as much information as we could on how the process was explained to us, what were the organizations we needed to find, where were the resources. And from that, we created a preliminary journey map where we looked at what were we feeling, what were we thinking, what were we doing, where were the gaps, where were we finding things, where did we not maybe know if there was more information that we didn't find, so that that could inform then how we designed a survey, and then moved on to co-creation sessions and individual interviews. So the survey was designed in Spanish and in English, because again, we wanted to make sure that we had a chance to reach out to different communities and different counties, different neighborhoods, different organizations. And so we were very careful to not only reach out to CPPR's network of partners, KDHE's partners, and the usual suspects in partnership, but also reached out on social media to try to find, informal childcare provider groups, maybe in counties that we didn't feel collectively that we had so much of a reach, to see if we could reach folks that we don't traditionally reach. And then I'll report back on how the survey went, but we were very pleased with the response we got. And that moved us then to creating a co-creation session where folks who responded to the survey could indicate whether or not they were interested in coming into a session, a facilitated session, where we would have facilitated conversation, again, around their lived experience around the licensing process. And then from there, again, identifying some areas of interest and maybe still some gaps, we continued with individual interviews where we had an opportunity to sit one-on-one with folks and ask them specific questions about their own lived experience. And then from there, we designed a refined journey map, which highlighted the findings that we heard and enabled us to identify some opportunities. If we can go on to the next slide, then I can dive into the survey, please. Thank you so much. So we ended up having 389 respondents, which we were super excited about, and a 43% completion rate. And that completion rate refers to the number of people who went to the survey and then chose to complete it to the end. 93% of respondents were owners or directors, and more than 70%, 70.6% of respondents had been in the childcare setting for more than 11 years. So that already was really interesting to us. Not a surprise, but certainly the proportion was notable of folks who really have been in this space for over a decade. And then the facility license type, 41% were licensed care home, 28% group daycare home, 23 childcare center, with the remainder of preschool and school age program. If we can move forward, please. Despite our outreach, which we found was still, successful given the rate of response we had, still 85% of respondents identified as white, and 4.9% as Black or African American, 4.1% as Hispanic or Latinx, and then 2.8% didn't wish to answer, and then with the remainder being Native American, Indian, Asian, Native Hawaiian, unknown, or other. I think other stated that they were American. The respondent role, as mentioned, 93% were owner directors with lead teacher and primary care provider at 26%. And then in terms of the respondents' primary language, English was also named as 99.5% and Spanish as 0.5%. And we can move forward, please. Thank you. 35% of respondents struggled with understanding where to start, where the supports that were available to them, and the licensing application process. 31% reported that they received or are receiving county or local level support, specifically from their surveyor. And 93%, and again, that was no surprise, indicated that children, kids, and families were the bright spots that kept them motivated throughout the process and certainly into the practice of their childcare provider services. We can move on, please. Thank you. So as mentioned, we tried to reach far and wide in terms of counties to at least get 1 or 2 responses per county. And as you can see, we still got our majority of responses from Johnston and Johnson and Sedgwick. But we did have coverage on many more counties, even if the numbers were a lot lower comparatively. And we can move forward, please. When we did the final journey, we mapped out, and I know this is difficult to read, but we're going to focus on some specific quotes that we pulled out. We really wanted to hear, again, the main impetus of this project was to hear from providers' lived experience. So we really wanted to use their own words to understand what the challenges were, what the bright spots were, where the opportunities were. And so we mapped it out as to what was mostly a positive experience, what was mostly a negative experience, what were connections, resources, processes, and opportunities that we identified throughout the process. So for the pre-licensing phase, we certainly heard a lot of serendipity around folks connecting with someone who was a childcare provider, telling them that this was an opportunity for them, folks who had kids and were at home and wanted to see if they could embark on this journey and be able to mind their own children or their children's children at home. We can move on to the next slide, please. And this is one of the quotes that stood out. I worked in the center for years, but it's not possible to support yourself if you're single working in a center. So I went out on my own. So right there, and as we know, we wanted to map the lived experience so that we could identify some quick wins and some opportunities. And so this was a quote that really stood out to us, just to illustrate some of the motivations that permeated the decisions that people made around what kind of provider they wanted to become, whether or not they wanted to be licensed, and what were their personal motivations to becoming a childcare provider. We can move on to the next slide, please. And so we went through the same process in the licensing, and what was interesting is that in all of the sessions we had, the co-creation, the individual interviews, there really was never a sense of negativity. I mean, there was really a communication around, you know, these are some of the challenges that we came across. This is where it's working. This is where it could be improved. And so we really got some qualitative information about how people were feeling about different parts of the process. And the licensing part was really around having an initial orientation and then largely feeling like the support wasn't maybe constant, and also that initial orientation was a little overwhelming in terms of the amount of content that needed to be digested and how it was delivered. If we can move on to the next slide, please. I wish there was a document that was all the steps needed and the recommended way you could go through those steps, like a new provider's toolkit that would really spell out all of the things you have to do, because we're just piecing it together on our own. So again, hearing those words, thinking about the opportunities that we as partners can come together to look at. We were pretty inspired by that quote, because obviously it illustrated where it could be better, but also relatively how easy it could be to make some changes that would have real impact on the lived experience of childcare providers. We can move to the next slide, please. And then the post-license, we were super curious again about, you know, what was the experience like? How much support did you get? How regularly did you receive support? What were the different ways in which a childcare provider might receive support? How COVID had impacted that experience, both from how folks were experiencing their work and also how they were experiencing the support they were or were not getting in these extraordinary circumstances. So we did hear that COVID had kind of slowed down the process of getting licensing, and we certainly heard that there was a real difference in the level of support that folks were getting from one county to the next and from one surveyor to the next. Again, not from a negative perspective, but from an observational perspective of how they were experiencing it. If we could go to the next slide, please. And this was one that really stood out for us. I felt dumb that I got those emails and I just deleted them. I could have had help, but I didn't understand it enough. I thought that's way out of my reach. I'm a home daycare. That's not for me. That's for facilities, or I don't know how to write a grant. How would I do that? So I would just ignore it. And that surfaced for us a few things. First of all, that childcare providers were often blaming themselves for not finding the resources that they needed or for not understanding the language of some of the tools that were provided to them. So that was interesting from an opportunity point of view for us, understanding that these are individuals, that they have a certain perception of themselves as entrepreneurs or as childcare providers or both, that they have a certain perception of what their business is like, depending on the size of their center. And also that that language really mattered in terms of language, and media mattered in terms of how much people felt support and knew that support was for them. If we can move forward, please. And one more time, please. So I included here some of the raw data so you could see the responses and sort of the number of responses we got for each. So as you can see, it reflects what we discussed earlier in terms of large, long period of time being in this space and presumably then approaching retirement. A majority of licensed daycare homes and a majority of owners, directors, which of course was understandable to us since we were really asking for lived experience. It was important for folks to have been involved in the licensing process. We can move to the next slide, please. And again, including primary language, ethnicity, we can move forward, please. And this is really more for our reference here. But in terms of the questions that we asked, so in the pre-licensing phase, we asked, what connections did you make during this time? And so we wanted to identify where were the nodes that people were really identifying and were clear, were providing resources for them. And so We saw, of course, the Child Care Licensing Department, the County Health Department, the local Child Care Licensing Surveyor, the Kansas Fire Marshal, Child Care Aware of Kansas, the Kansas Department for Children and Families. And then, there were some other outliers, if we can say. And then we also asked what resources or supports were missing or did not meet your needs in helping with obtaining your childcare business license. And interestingly, a lot of folks said that they were able to find everything they needed. So 36%. And then 30% said understanding where to start. And then certainly in the qualitative conversations that we had, it did come back that there was a hope of having kind of a centralized place where you would get kind of a checklist of everything that was required, and certain. One person we heard from, for example, which was interesting, said that they were opening a childcare center in their home, and they, through that process, realized that their regular home insurance was no longer going to cover them, and that they had to get new insurance and that it was a lot more expensive, but they hadn't found that information anywhere else. So of course, had we not conducted these interviews, we never would have gotten that one kernel of information. But it was super interesting for us to sort of hear those details because of all the various levels that folks have to concern themselves with to ensure that they are fulfilling all the requirements of the licensing. Could we move to the next? And what were the most challenging processes that you experienced during this time? Understanding where to start, ensuring I had the funding, developing a business plan, securing a physical space, securing insurance, meeting state and local fire codes, navigating local zoning challenges, registering with the IRS, determining my eligibility, and identifying which type of provider I would be. So we kind of echoed these questions throughout the pre-licensing, licensing, and post-licensing. If we can go forward, please, to really identify where were folks connecting with other folks in this space, where were they feeling that they were getting the most support, and where were there opportunities to clarify or to better support as they went along this journey. And we obviously continued to separate it into 3 phases. Can we move forward, please? And one more. So again, here for the launch and post-licensing phase, we were looking at what was challenging, what connections were made. Please move forward. What barriers, and then what bright spots were the most visible and enduring for childcare providers as after they launched and carried on with running their center. Could you move to the next slide, please? So based on that, we then delivered some initial recommendations to CPPR, and it became really clear that so many of the opportunities that we identified based on this exchange with childcare providers and through the survey was that there was a real opportunity to engage partners to further this work and to have you as experts come together and see which opportunities might be the most promising, the most impactful, the most readily ripe, let's say, to be implemented. And we were really thinking about, obviously, pilot opportunities or sprints that might have disproportionate impact on areas that the state is currently pursuing or that partners are already pursuing, and could also have an impact in adjacent areas. And as a result, we then convened a group of partners in a facilitated co-creation session on May 11th. If we can go to the next slide, please. And I'm going to pass it over now to Megan. So we went through a half-day exercise to engage with this community to really identify some of the opportunities that we could pursue based on the initial research that we did up to that point. Megan.
Thank you, Isabel. Next slide, please. Okay, actually one more. Perfect, thank you. So in May, we hosted a co-creation session, as Isabel mentioned, and it was about 50 members of KDHE and DCF staff, as well as childcare licensing surveyors and several providers that participated in the survey and or interviews and co-creation session. We brought this group of people together to have a half-day session to really dig into some of this data and think about what can we do with this? How can we use this to think about different ideas and really build upon, I think, what has been working well. And there were quite a few positive things highlighted throughout this process of really things that could be scaled in different areas across the state. And so there were several breakout sessions and everybody worked from the same prompt. How might we make Kansas the best place for quality childcare for everyone involved? Next slide, please. So the result of this session was this document that you see here, and don't worry, all of this will be shared later so that you can dig into it a little bit more. I know it's a little bit hard to read here, but the breakout groups all identified 5 ideas responding to that question of how do we make Kansas the best place for quality childcare for everyone involved, and presented ideas which led us to this list of 29 ideas of things of all sizes that could potentially be tested and implemented to just see what kind of difference they might make. And I really mean all sizes. I think, as Isabel said earlier, I think ease of implementation is very relative, not to imply that any of this is a super quick fix, but I think there is a range of things like the toolkit that was mentioned specifically in the survey response. That was an idea that was developed of thinking about, could we put together some sort of checklist or timeline or just document where people could kind of get a sense of what are all the steps that you need to take in order to start and license a childcare business. And even then what happens in the years after you've gone through that process. So you just have a place that you can go back as a reference. We also have, pretty major concepts like living wages per provider. So there's a broad range of ideas here. And I'm going to share a little bit more about sort of what's happened with these ideas. But I would encourage you to dig into these a little bit more and think about what other ideas you might have as well. Next slide, please. So the mapping findings and the ideas that I just shared have been shared with several of our partners, including KDHE, DCF, the Children's Cabinet, the State Directors Team, the Early Childhood Recommendations Panel, and the Child Care Systems Improvement Team. And we really wanted to kind of present all of this information. It's quite a bit to digest and let people think about how can this be used, one, as a way to embed provider voice into their work. We all know that is a critical thing to do. And we have nearly 400 providers that participated in this process. And we want to make sure that we're using this recent data and responding to it. And also thinking about how can this information really complement conversations that are already going on across the system. We know there are a lot of big ideas being shared and a lot of discussions around providers and just the system in general. And so this really is designed to be information to just help support those conversations and be one more resource for everyone. Next slide, please. So all of this information will be available with the recording for this webinar, as well as in formats that you can download from the Cabinet website so that you can really dig into this. And we do encourage you to use the data as well as the ideas in your own work. I think there's not a lack of ideas, and certainly there are more than 29 ideas out there to be developed, but I think these provide a nice starting point. And I'd encourage you to think about how can they be further developed or how could they be tweaked locally? I think a lot of the conversation we've had to date has been more on a state level. What could we implement? What are some of these ideas? But I think a lot of them really could be tweaked to different community needs.
Come here and have me do.
For example, once you have a chance to dig into some of the ideas, there's several that have common themes. And one theme that came up consistently was, how can we think about how we recognize providers in a different way? So people talked about hosting an event or having some sort of, when you go to the grocery store, some way to recognize childcare providers, whether that's a discount or some sort of kind of public visual to recognize childcare providers like we do with some other industries, things like that. There were also a lot of ideas around family awareness, community and general public awareness around the importance of childcare or the importance of healthy developmental milestones. So thinking about how can you take some of these ideas, which I think are kind of right in the sweet spot of being developed enough to really start the conversation, but very much raw and ready to be further refined or to be kind of modified to meet your needs. So again, this information is really available for everyone, and we hope that you can use it in your work. Next slide, please. Thank you. So again, I don't want to undersell it. We had nearly 400 providers participate in this process, and that's exciting. And I think this is a very valuable source of recent provider input. This is all in the past few months that we can all use, but I think also build on to make sure that we are creating and supporting ongoing opportunities for providers to share their voices at all levels of our system. So with that, we do want to open it up to discussion and make sure that people have time for questions and just see how you feel like this can be helpful in your world. But I also want to say a huge thank you to the providers who've participated throughout this process, as well as to all of our partners who supported this. We really could not have done it without all of you. And then my contact information is here if you're interested in getting involved or if you have any questions after today. So thank you so much for the opportunity to share.
Well, thank you, Megan and Isabel, for presenting all of this information. I'm also very excited and impressed that you had so much provider participation in this. That really helps us get a better picture of what they're experiencing. And so in the chat, I have a comment here from Rich Mender saying linking location of childcare to transportation using GPS and geocoding could be useful for families who need to make multiple trips. Pamela Beach says this is wonderful to be able to take the conversation into local areas as we work to build capacity in childcare. How could we be partnered with you to share this and start the conversation? So Megan or Isabel, do you have any comment to that?
Well, first of all, I'm excited that people are thinking about ideas. Rich, your wheels are clearly turning, which is great, and thinking about how they can use this in their work. So I would say to anybody who's interested in kind of digging into the data a little bit more, or just kind of thinking about how they can use it, feel free to reach out to me. My email is here on the screen. But yeah, I think you're right that it is a good tool to take in to start some conversations. And of course, we know this, but I think it came up often throughout this process that it's a different experience for each person, and it's a different experience depending on where you are in the state. And certainly with COVID, I think that's even one more layer of kind of different experiences. And so I think it's important to kind of take this data and use it as a tool to have conversations about what people are actually experiencing in your area.
Isabel, I was wondering if you could provide a little bit more information. I remember at one point you'd mentioned that there was a disproportionate factor for providers when certain funding recipients like CBCAP were involved. Can you explain that a little bit more, like what that bullet was about, where the disproportionality comes out?
Oh, yes, sorry. I kind of went through that quickly. In our recommendation, we were looking to see where would there be an opportunity for an initiative to be developed where it would have impact not just on the licensing and on the experience of childcare providers, but potentially in other areas of minding children, children's safety. In this instance, specifically, we were thinking about some initiatives that the state is already involved in or that CPPR is already pursuing, where we might actually develop a solution for one issue that we see, and it would have positive repercussions on the broader system. Does that clarify what I meant by that?
Yes, so not saying that the abundance of resources in an otherwise, we'll say, desert is causing disproportionality, but utilizing the STEAM that's already in that area to further allocate the resources.
It was more so around some of the opportunities that we identified. So say, for example, we developed an incentive to attract more childcare providers to an area. And as a result, more children were able to be put in care, and therefore they would thrive in the long term. So even though our initial goal is to attract more childcare providers, we can see a ripple effect of solving that issue on adjacent areas.
Yeah, that makes sense. I had another question about the respondents, the provider respondents. So the 36% said, you know, overall they were able to find what they needed as far as resources. They were able to figure it out. And then stark contrast, you had like 30% that, you know, struggled. Were you able in the data, were you able to make any inferences about what made those differences? You know, was it location, is it experience? Like, was there anything else that kind of explained why there was such difference in the two groups?
Yes, well, and I think that I think what Megan said is accurate in that everybody had a different experience. So, but what we tried to identify in the survey, and I'm trying to think if I included it in the raw data, was we looked at, and forgive me, I'm just pulling up the data here so I can give you an exact answer, is we tried to pull out some of the barriers that they might have encountered. So some folks, it was like getting access to the right technology to access the KDHE platform. Other folks, it was, I just didn't know where to start. Other folks were saying, well, I didn't realize I needed to speak to the fire marshal versus, so we tried in the subsequent questions to have people identify specifically what for them had caused them not to find everything they were looking for. I'm looking here.
I think while you're doing that, Isabel, I just want to note too that as we saw, there were people that have been providers for up to or above 20 years. And so I do think it is worth noting that people may have had very different experiences also based on the time they went through some of these processes. And I think we know some of that, but just to put that out there, that certainly things are always changing. And so I think that's important to note that people may have, you know, experienced this more recently or 5 to 10 years ago, and just certainly things are continuing to evolve.
And the top responses was 30% of folks had a hard time navigating the KDHE online portal. Other folks just didn't understand the licensing application process. That was 18%. And then filing an application with the KDHE was 11%. Meeting state and local fire codes was 10%. So we were able to break it down a little bit more to identify where some of the opportunities were.
But we don't know, I guess, we don't know necessarily what the risk factors are for a potential provider to make it more difficult for them. Like, you weren't able to extrapolate that.
Right. No,
okay.
I mean, I think we would have very granular one person's barrier, their story of it, but we were not able to identify, you know, trends, except for maybe money. That certainly came up often, that folks would say it's an expensive process to go through, and while you're waiting, if the process is delayed, that pressure is greater, of course. So we had multiple anecdotal accounts of folks saying, oh, good thing my husband is working because he was able to support us during that transition. So that was one.
This is Sarah Gardner. I'm also with the CPPR team. And I want to call out Rich's comment here in the chat too about the start local investments and shared resources. And I know that shared resources is on a lot of people's minds right now. I know the Child Care Systems Improvement team is trying to think about, like, how can we leverage that? I think one of the themes that we noticed in the data is just how solitary the journey can be, and where can we add support along the way. I think support was like maybe the word that was used more than any other word in the responses, and it is roles for locals, for community supports. There's opportunity for our surveyors and our licensing teams, which is why the SIT team is so interested in this. And they are, the surveyors were a big part of that co-creation session and really looking to find solutions. We know our Links to Quality team is interested in this information as well. So how do we wrap those supports around providers at all stages of their journey so that it doesn't feel so isolating or solitary? Because as you can see, thematically, it does feel similar. Like, so if one person goes through it, there is likely lessons to be learned from it. And how can we use those lessons and share them with other providers? So that's just a comment kind of back to Rich's note. And the other thing I would say, and I think Pamela, you might have mentioned, how do we start this conversation locally? And one thing I would encourage you to do is, if you have access to childcare providers in your area, if you're a service provider, if you are a childcare provider and you have a peer group, is see if this data rings true for them. See if these experiences and some of these themes and these trends ring true for them. And how have they overcome some of the barriers? What are some of the little nuggets, the tweaks that people have done along the way that we can then scale, or say, you know, this maybe this community came up with a cheat sheet, or maybe this provider came up with a checklist. You know, not all solutions have to come from the state agencies who provide the, you know, the regulatory or the check on that service. And how can we learn from where things are, where the innovation and the resilience happens at a local level? So would definitely encourage you to see if these experiences ring true for the locals in your community. And if so, and they have, you know, overcome these barriers in really innovative ways, how do we learn from that and do more of it, and scale some of those good ideas? So thanks for listening, guys.
I would echo that too. Thank you, Sarah. I think that it's easy with data like this, I think, to kind of zoom in completely on what the challenges are. And certainly we need to look at that. But I think we learned just as much about the things that are working well. And that we did have, I think, both in the raw data and in some of the more anecdotal conversations, things that worked. You know, people did have positive experiences or connections that really supported them, or did feel like they got everything they needed. And so I think, to Sarah's point, think about or talk to providers and find out, does this ring true to them, but also find out don't just ask the question of what's not working. I think, what are the things that are working? Because I think to me, one of the most exciting things about this process has been, I think, the identification of some steps that we could take that do feel pretty doable, or at least, you know, start having conversations around them, of things that could have pretty major impact, but they're already being done in local levels, and we know that they're working well, and it's a matter of scaling. It's not necessarily always reinventing the wheel.
I'm going back a little ways into the chat, and Gretchen had commented how nice it would be to have a handbook for new providers in each type of childcare facility. And so I know that I think that was somewhat in line, wasn't it, Megan, with one of the main areas that you identified as a priority?
Yes, there's been some discussion around some sort of, I think it's a different noun each time, but a toolkit, a checklist, a handbook, so I think some sort of written document. And so I think there absolutely are conversations going on around that, and we'll continue to be, I think, evolving as needs evolve. Again, we know that I think there's some solutions that are being considered for now, but I think there are a lot of ideas that we can start with and we can continue to build upon as we hear more from providers about what they need.
Well, I love all of this information that you've been able to gather, and speaking as a former childcare provider, I can relate to many of these things that have been said and that are happening at all of these levels. And, you know, I could just add that there are just so many layers to the process of getting licensed and then eventually taking care of children. And I think a lot of providers really are great caregivers, but this process of licensing, they just, it's a learning process in many different ways for all of us. And so having this information is good. And again, having that many providers contribute to this conversation is just going to be very helpful moving forward. So I thank everyone for your comments and for the conversation that has happened here around this work today. And we're going to be keeping an eye on this as this moves forward. And we're just going to continue to see more good things happen by using these results. So if no one else has any questions or comments on that, well, and I also just want to shout out to all of the childcare providers that are listening in today, because your work is so valuable and we appreciate everything that you do. I have a request, and I apologize in advance if I'm saying your name wrong, but we have a Tasia Markowitz from the Kansas Masonic Literacy Grants that wants to share some information with us, give us an update.
Hello, thank you, Debbie. I appreciate that. I will just hop on here very quickly. I stuck a link in the messages. The Kansas Masonic Literacy Center, we are housed here at Emporia State University. And hot off the press, we have a request for application up to $10,000 for several communities. And what we're going to be working on is early literacy. And so you can find all the information there in that link. Please feel free to email me or give me a ring if you have any questions. You can share it out with others if you would like. I'll go ahead and stick my email in here as well. Okay, thank you.
Thank you. It was great to get that information from you. I'm glad that we had the time to let you jump on there. So I think we are basically wrapping up today's webinar. As usual, we want to remind you of some of the upcoming meetings that are taking place. The next Early Childhood Recommendations panel meeting is scheduled for June 18th. Those meetings always take place on the third Friday of every month in the mornings from 9 to 11:30. And you can find registration and YouTube viewing information for that on the Cabinet website. And then our next biweekly webinar is 2 weeks from now on June 16th, Wednesdays at noon. And we always welcome you to contact us and let us know if there's any topics that you're interested in learning about, or if you have information of some kind that you would like to share, either as an update that we can give for training opportunities or learning opportunities, or presentations such as we heard from Megan and Isabel today on work that's going on. We do have a children's cabinet meeting scheduled for this Friday on June 4th. That happens from 9 to noon. And then the stakeholders group meeting will be that same afternoon. And you can also find information about that on the children's website, Children's Cabinet website, as well as always welcoming your feedback. So there is a link here on the slide that you can go to always share feedback about things that you want us to hear about in the work and the world that is going on around us in early childhood. And so we thank you for joining us today. And I would like to end our meeting with an ode to a childcare provider, since we heard a lot about what childcare providers had to say today. Little children come to me for hugs and books and such. I care for all their simple needs, and I also fix them lunch. I pick up toys, I mop their spills, and often dry their tears. I change their diapers, settle fights, and kiss away the tears. I tie their shoes, I button coats and push them on the swing. I really love these kids, you see, but there is just one thing. Call me Mom or Aunt or Ann, and those names just might fit. But please don't call me Sitter, because I never sit. So thank you to everyone for joining us today. Have a great rest of your day, and we will see you back here in 2 weeks. Goodbye, everybody.